5 sure signs and symptoms of lung cancer you should not ignore. You might dismiss lung cancer because you don't smoke, or because you live in a less polluted area. However, it's important that you understand the early signs of this illness in the event that you or someone you love develops this dangerous disease. According to the American Cancer Society, as many as 20% of people with lung cancer were diagnosed as non-smokers. While these patients may have eliminated an important risk, secondhand smoke, environmental factors or gene mutations may have triggered their onset. In addition, lung cancer is the leading cause of cancer death as well as one of the most common types of cancers overall. Of new cancers diagnosed each year in the U.S., about 14% are lung cancer cases. Important signs of lung cancer. With numbers like the ones above, you shouldn't wait around with lung cancer. If you notice any of these 5 common signs of lung cancer, consult your doctor immediately. 1. Persistent cough. A common cold or other respiratory illness will cause a cough, but only for about a week or 2. If your cough keeps going for a month or more, you should get it checked out. Also, let your doctor know if you're getting sick repeatedly, and each illness goes straight to your chest. 2. Abnormal breathing or wheezing. Patients with lung cancer usually notice a change in breathing. Having shortness of breath or difficulty breathing after activities you normally find easy suggests a problem. Similarly, don't dismiss wheezing as a symptom of allergies, unless your doctor has confirmed it. Wheezing happens when your lungs are constricted or blocked. Check into it, especially if you haven't had a recent cold or known allergies. 3. Hoarse voice. Lung cancer may start pressing on the nerve that controls the larynx. When that happens, you will notice a change in your voice, such as a deepening or hoarseness. You should take note if the change lasts for more than 2 weeks and let your doctor know about this symptom. 4. Unexplained weight loss. Have you lost weight without trying recently? Although effortless weight loss might excite you, it could mean a deeper problem and needs your doctor's evaluation. Coupled with any of the other symptoms here, the weight loss may directly signify lung cancer. 5. Back pain. Finally, a lesser-known sign of lung cancer is a deep ache in your bones or joints. Many feel this ache in the back or hips, and the pain may worsen overnight with sleeping. Diagnosis: what to expect. The best way for your doctor to screen you for lung cancer is through a low-dose CT scan. A simple X-ray may not catch the disease in its early stages. During the CT scan, an X-ray will scan your body, while low doses of radiation will create detailed pictures of your lungs for your doctor.